Dah masuk. Okey. Okey.
Doktor?
Hello, Assalamualaikum.
Waalaikumsalam.
Waalaikumsalam. Doktor dah present slide tu full screen ke?
Belum. Sekejap
Okey.
Kita tengah tunggu lagi kan?
Kita akan start pukul 8.
Nak try saya punya mic jadi tak? Hello?
Jadi.
Jadi, okay, thank you. Brothers and sisters, the event will start shortly. Thank you. For your information, the attendance and evaluation form will be given in the chat box at the end of the event. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. A very good evening and warm welcome I bid to our guest of honor, Dr. Nurul Yakin Muhammad Nur, our speaker for tonight. Honorable lecturers, our dear IIM content community, brothers and sisters. Welcome to the MUK webinar series 2, Cervical Health, Peace of Mind. My name is Nur Hikmat binti Zakaria, Year 2 student from Kuliah of Dentistry, are delighted to be your MC for this program. To gain blessings from Allah subhanahu wa ta'ala, let us commence this program with recitation of dua from Sister Nabila Huda, Year 1 student from Kuliah of Dentistry. Please welcome.
الفاتحة. بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على سيدنا محمد وعلى آله وأصحابه أجمعين. اللهم اجعل جمعنا هذا جمعا مرحوما، وتفرقنا من بعده تفرقا معصوما، ولا تجعل اللهم فينا ولا معنا ولا من يتبعنا شقيا ولا مطرودا ولا محروما. اللهم اجعل خير أعمالنا آخره، وخير أعمالنا خواتمه، وخير أيامنا يوم ألقاك فيه. اللهم اغفر لنا ذنوبنا ولإخواننا الذين سبقونا بالإيمان، ولا تجعل في قلوبنا غلا للذين آمنوا ربنا إنك رؤوف رحيم. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. وصلى الله على محمد وعلى آله وصحبه وسلم، والحمد لله رب العالمين.
Amin Amin Ya Rabbal Alameen. All praises be upon Allah, the most gracious, the most merciful. Peace and blessings be upon the Prophet Muhammad, his family and companions, and those who follow their footsteps until the Day of Judgment. Brothers and sisters, before we proceed to our highlighted event tonight, please allow me to introduce our honorable speaker for tonight. Our speaker, Dr. Nurul Yakin Muhammad Nur, graduated with a medical degree at Volgograd State Medical University, Russia Federation in 2013. She was a house officer in University Malaya Medical Center from 2013 till 2015 and a medical officer in Hospital Sultanah Nur Zahira from 2016 till 2017. Dr. Nurul Yakin is also a trainee master in obstetric and gynecology department, Kuliah of Medicine, International Islamic University Malaysia, Kuantan, since 2018 till present. Hence, ladies and gentlemen, with great honor and privilege, I would like to call upon Dr. Nurul Yakin Muhammad Nur to deliver her speech entitled Cervical Health, Peace of Mind. Please welcome.
Doktor, buka mic.
I'm sorry,
Okay.
Doctor. We couldn't hear you.
Give me a minute.
Okay. Thank you.
Okey. Boleh nampak kan?
Boleh, Doctor.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. So first of all, I would like to thank the organizing committee, MUK, Mahala Kalthum, for inviting me to share the topic about cervical health, a peace of mind. So what we're going to talk today will be about the health, the care, and also the disease prevention. So as mentioned, my name is Dr. Nuraki Muhammad Noor. I'm a trainee lecturer in Obstetric and Gynecology Department, Sultan Ahmad Shah Medical Center, IUM lah. So let's begin. But before that, I would like to introduce you to my teachers and also my journey throughout understanding the women health. So on top left is me attending a gynae oncology conference with my fellow colleague and also my lecturer, Dr. Raja Arif, which currently work in...
Sorry, Doktor.
Yes.
Doktor tengah present slide kedua ke?
Yes, yang kedua. Dia
Oh,
start
it's not moving.
Macam mana nak buat ni? In that case, probably the organizer can share my slide.
Boleh Cik ni.
Sekejap, nak stop sharing. Saya dah stop sharing kan? Actually, I prefer to present my own slide because I want to do a pointer. But probably our organizer can help me pointing out.
Give me a few seconds ya. Boleh nampak ke?
Cuba boleh.
Boleh kan?
Okay. Doktor. Doktor mute.
Sorry, I said the mute. So thank you very much. So inshallah, we're going to proceed with cervical health, a peace of mind. So I'm going to highlight, actually the peace of mind is because in regards to the cervical cancer, because it's a silent killer. And to have a peace of mind, you have to get it checked. So can we move to the second slide? So this is a picture of my journey in understand the women health. So my the first picture is me attending a gynae oncology conference with my lecturer, Dr. Raja Arif, and currently working in Avicina. And this is my teacher back in Hospital Sultanah Nur Zahira, Dr. Wan Rusmida. Is also a female gynae oncologist, a very strong lady, because gynae onco is a field where you have to do operations about 3-4 hours long, standing operations with the difficult cases. And this is a very renowned professor, Prof. Mukhtar, a teacher of all teachers for gynae oncology, which currently works in SASMEC. And this is my beloved Prof. Hamiza, the head of department in obstetric gynecology, which is currently our HOD and a fetal maternal. And this is me attending a workshop for colposcopy, which specifically deals with the cervical diseases. Okay, next. Next slide. Okay. So initially, I was given a topic about the vulva and vagina health, which I think is just a tip of the iceberg, because we have a lot more complicated and sophisticated organ behind the vulva. So in a nutshell, vulva is the external female genitalia. Next slide. So as you can see here, what we call as vulva is only the outer part of the female reproductive system, which it's composed of clitoris, whereby it's very rich in the nerves, which is a very important part that can make the women have an orgasm during the sexual intercourse. And this is the external urethral orifice. I'm actually pointing on the second image. Okay, so the external urethral orifice is the opening where the pee during the urination. And also we have a vaginal orifice next to it. Just below it is the opening to the vagina canal, which is a very amazing and sophisticated organ as well, because it can contract and it can dilate and it can modulate during the delivery of the child, of a baby. So it's a very complex structure with a unique function. And also we have Bartholin gland, which gives a lubricant. And also we have two folds, which is a labia minora and also majora. So if you talk about vulva health, basically it's about this part only. And the problem related to it is many, but the cancer is very rare, which involve this part. And after that, we have vagina, which connects the vulva to the cervix. And next slide. And talk about vulva and vagina. It's a very fantastic, amazing organ where it has the ability to clean itself on a daily basis. That means a woman does not need to clean or do vaginal douching, or you don't have to insert anything to clean the vagina itself. It can clean itself. It has a very sophisticated system that Allah created, and it can self-cleaning. So you don't have to do anything. Just make sure a perineal hygiene outside the vagina, at the perineal area only. So apart from that, for a healthy sexual life, it is to have 2 to 3 times a week sexual intercourse. And monthly basis, a women will have menstruation. And as you know, menstruation is a different spectrum of problem, where you have a mood swing, and then suddenly you have, because you have so many pain, breast pain, back pain, abdominal crampy pain, and it's invisible. And sometimes it's also associated with headache. And some of us might experience acne, and also increase of appetite and increase of weight, of course, word problem. So menstruation itself is totally big issues for women, especially in the reproductive age, like our audience today. And also 2 to 3 yearly, it will has a ability to deliver a baby. So it has a very multi and also unique function, and it's very complex in its own way. And that is why women is very unique and complicated. Okay, next. So a bit facts on vulva. So normal vagina flora is normal vagina is about 4.5, the pH of it. So as you can see, 4.5 is actually acidic. and it contains lactobacilli bacteria. It's a healthy bacteria that helps to maintain this pH so that it can act as a protective barrier. That is why during menstruation, it is prohibited in Islam to have sexual intercourse, because at that time, as the blood is more alkaline, it will change the pH of the vagina, and it causes the protections to become weak. That is why intercourse during menstruation is prohibited by Islam, and also it is dangerous for the health, and it can cause some ascending bacterial infections that might contribute to pelvic inflammatory diseases. And when to seek doctor? Basically, since it has bacteria there and there is a mucus there, so it's quite common for a woman to have vaginal discharge. But it is abnormal when you experience a foul smelly or fishy odor discharge, or greenish or yellowish color discharges, and also if the discharge associated with itchiness, it is also actually abnormal. To get yourself checked. And if there is any genital lesion, of course, you have to see your doctor. We're gonna do investigations and look whether you need antibiotic. Because if you experience this kind of abnormalities by using, I don't know, Cervical, whatever brand of the feminine wash won't help, because it's more to it the microorganism that is abnormal there, or if there is any bacteria, then we have to treat the infections. So basically, if you have these symptoms, go and find your doctor. Probably you can get a treatment from there. So another highlight for tonight is there is no need of vaginal douching. It can clean itself. It's a very sophisticated organ. You don't have to interrupt. And what you need to do is you don't have to use feminine wash, because it can disturb the pH, the vaginal pH. And then just make sure you use a cotton undergarment so that better ventilations down there. And if you experience any of these abnormal discharges, maybe it is good not to have abstinence, not to have sexual intercourse during the acute infection. And if it's impossible, for example, probably the second best choice would be use barrier methods. Okay, and then I don't know whether it is a common sense or what or no, but I hope that everyone know that we have to wash the perineum from front to the back, because if we wash the other way around, the urethra can be infected with the bacteria from the anus. So the urinary system should be sterile. So to reduce the risk of infection, we have to wash from front to the back so that the bacteria from the anus does not get into the urinary stream or tract. And then it's also a common sense to change sanitary pads for 4 to 6 hourly, because keep it longer than that, usually it can contribute to the abnormal bacterial growth there and cause infection. And the sexual partner, of course, as a Muslim, even though it's actually quite surprising, not that surprising, and it's no longer uncommon for our Muslimah in Malaysia, Melayu sama. That's the sad facts, but we have to admit that this is actually our society problem. Having a very early sexual exposure with multiple partners. So bear in mind, it is not healthy to have multiple partners. And also how to maintain the good conditions of the vulva is not only the hygiene, but also the function of it, and by doing Kegel exercise. So next, if it's alien to you, what is Kegel exercise? Basically, it's an exercise that strengthens the pelvic muscles. So you don't have to do these positions actually. It can be done while sitting down or standing or studying or watching Netflix. You can do anytime, anywhere, no one knows. So basically, it contains fast and slow twitch. It is to actually stimulate the muscles, the pelvic muscles, so that we can have a better support to the organ, especially the bladder and also the rectum. As you know, this is a common problem for elderly women, but by doing Kegel at a young age, you can actually reduce the risk of having this prolapse. And then it's facilitate the normal vaginal delivery. And also if a patient experience what we call perineal trauma during birth, for example, a tear extend to the anus or involving the sphincter, the anal sphincter, Kegel exercise would be the best what we call physiotherapy to help in the outcome of to improve the outcome of the perineal sphincter injury. And then Kegel exercise also is a very beneficial exercise for those who having problem, for example, while sneezing or laughing or coughing or long standing. Some women can experience leakage of the urination of the urine. So this is actually quite common for the elderly lady. So by doing Kegel also, this can slow the progress of the incontinence or restore the normal functions of the bladder neck. Okay, and also it's improve the sexual health. So how to do it? So we have two kind of Kegel exercise. The first one is to hold just imagine that you try to hold your urination for about 2 to 3 seconds, and then you release the muscles. So let us try to do it now. So let me count until 3. So you try to hold your urination for about 3 seconds, and then you release, and then hold again. Do it about 10 times. Okay, let's start. Okay, 1, 2, 3, hold. 1, 2, 3, release. 1, 2, 3, hold. 1, 2, 3, release, without using any abdominal muscles or external muscle, only purely the pelvic muscles. So how to do it? Try to imagine like you try to hold your urine. So hold your urine. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. That's a fast twitch. But slow twitch is an exercise when you can try to hold the urinations for about 10 seconds. So for example, 1, 2, 3, 4, 5. You can breathe, you can talk while trying to hold your urine. You don't have to like sit still. So 6, 7, 8, 9, 10. And then release. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, try to hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So do it for 10 cycle. Then it's actually a Kegel exercise for slow twitch. So by doing this, inshallah, you can help to improve if you have this kind of problem. The incontinence is not only involving the elderly women. Sometimes young women also can have incontinence, especially for those post-delivery, postpartum. They might sometimes complain of this. Okay, next. That is for Kegel exercise. So now it's about, I think it's still a taboo in our society, Malay society, to talk about sex and also the reproductive health. So basically, healthy and also a good sexual health is to have intercourse 2 to 3 times per week. This is just a general knowledge. I know some of you might not yet married now, but inshallah soon. So for you to know that actually in Islam, sexual intercourse should be safe and also pleasuring. And how this can happen is by having a good lubricant from the battling gland. And also after intercourse, a woman does not need to clean the vagina, just the vulva, just the external part of the female genitalia. No need to do any douching. It can clean itself. And some of the women might worried about the pubic hair. Basically, pubic hair is something that is normal. You should gain confidence, even though you have ingrown pubic hair, just to keep it clean and also not too long. Especially if you goes into labor, please don't leave it too long because it's very difficult for the obstetrician to repair with the hair all around. It's also a common sense. And a woman should know if there is during sexual intercourse, if she develop any pain, then it is actually not normal, and she needs to get a help from the medical doctor, especially because vaginismus is not something that is well addressed in our society. Sometimes the women can have vaginismus. So vaginismus is a condition where during intercourse, because of some psychological issues previously, the women experience pain because during the penetration, the muscles is contracting. So there is no room for the penetration, and it causes a very traumatic event or incident or event. And the women tends to avoid intercourse with the husband. So it is not normal. I have a patient who comes after 8 years of marriage, then only come to get help. So it's actually quite a sad situation because this can be addressed earlier, not after 8 years of marriage. So probably an education and also advocacy can help our women. And also painful intercourse, one, vaginismus, and another thing probably after during the intercourse itself, a woman can experience pain. So sometimes this kind of women actually having other underlying disease, which is endometriosis, and this also can be addressed by seeing your doctor. So in Islam, we have to discuss because it's already in Al-Quran also Allah describe about sexual intercourse lah, which is in Surah Al-Baqarah ayat 223. A'udzubillahi minasyaitonirrajim. Nisa'ukum harthun lakum fa'tu harthakum anna syi'tum. Isterimu adalah ladang bagimu, maka datangilah ladangmu itu kapan sahaja dengan cara yang kamu sukai. So basically, this is actually in relates to the endometriosis, because sometimes the women with endometriosis, they have a problem when there is a deep penetrations during the intercourse. So when we have this ayat in Al-Quran, that means Allah addressing this issue, because not all women can have the similar positions. So that is why Allah says Fa'tu harthakum anna syi'tum. Ikut mana keadaan yang sesuai. Macam itulah. Nak tahu lebih lanjut kena datang jumpa doktor lah maksudnya. Mungkin tidak sesuai dibicarakan pada seminar malam ni. Tapi maksudnya it is not something that shouldn't be discussed. This can be addressed. Allah pun ada sebut dalam Al-Quran. And then Nabi pun ajar cara a doa before sexual intercourse. So Bismillahirrahmanirrahim. In the name of Allah, Allahumma jannibna syaitan wa jannibi syaitan ma razaqtana. That means, oh Allah, keep the devil away from us. So we want the intercourse to be purifying and also away from syaitan. And wa jannibi syaitan ma razaqtana. And we want to keep devil away from what you have blessed with us. Because just for you to know, to have a marriage and healthy couple and healthy individuals, and also a normal sexual health is actually a bless, and it's actually an ibadah. So that is why in all the things that we do, we have to pray to Allah so that shaitan won't join the process. And next, okay, and if the same action done with a wrong person at a wrong time, or with the right person but at a wrong time, out of from the wedlock, then it's become a sin. So Allah also mentioned wala taqrabu zina, jangan hampiri zina. So basically it's the same similar action but right person and right time. Macam tu lah. Why I'm highlighting this to all of you, because it is no longer uncommon for our Malay population, Muslim population to have involved in zina. It's a very sad fact, but yeah, it happening in our society, in our Sikh society, and it is our role to highlight on this, because this should be something that is purifying and ibadah. Okay, next. So come to my to the highlights of our discussion today, which is about the cervical cancer. So we have talked about the vulva health, the vagina, a bit on the sexual health. So now I want to share with you about cervical cancer. As you can see on the top left is the statistic for Malaysia statistic in 2012 2016, where as you can see the first one, number one cancer in women is breast cancer, and you had the lecture previous week, and cervical cancer is the third highest, the number 3 in the rank. So cervix uteri is the cancer of the cervix. As you can see here, there is a normal cervix with a normal vagina, and the middle picture is the late stage of cervical cancer. Why it says it's a late stage, even though the lesion, the abnormal cells is only small and only involving the cervix, right? It does not extend to elsewhere. But it says here it's a late stage of cervical cancer because the first stage of cervical cancer is only involving about 7 millimeter with a depth of 3 millimeter. So a very small microscopic level kind of lesion. That is the early cervical cancer. But once it involves more than 4 centimeter and involving tissue surround the cervix, it's already an advanced cervical cancer. So that is why we say that cervical cancer is a silent killer. The patient won't notice the cervix to be unhealthy until, for example, a woman after menopause for a few years, suddenly they experience a postmenopausal bleeding. They had a vaginal bleeding after menopause for few years. That is because of this bleeding from this unhealthy cervical tissue. As you can see down here, probably that at the initial stage of the cancer, it is still small. Ni gambar nombor 2 dari bawah ni. So it's still small, unnoticed. If there is no screening done, then the woman won't come to hospital or won't come for the gynecologist assessment, and it will grow, go all over the circumference of the cervix, and finally it will become larger and larger. And just to let you know, next to the cervix, about 2 centimeter from the cervix, laterally or to the left or to the right, located the urinary, what we call a ureter, or the connection from the kidney to the bladder. So saluran kencing lah, saluran kencing, the ureter. So if the mass invade the ureter, the women can experience what we call hydronephrosis ataupun kidney bengkak. Kidney bengkak, buah pinggang bengkak disebabkan oleh saluran kencing yang tersekat disebabkan oleh tumor yang telah merebak. So sekiranya keadaan tu berlaku, dia adalah kanser yang dah melarat dan tidak boleh dilakukan operation. Mungkin cara terbaik pada waktu tu adalah kemoterapi dan radioterapi, di mana kemo dan radioterapi ni selalunya mempunyai side effect yang lebih teruk lah. Bukan lebih teruk, maksudnya dia punya side effect terhadap tisu-tisu yang normal tu pun ada. Jadi sometimes itu yang kita kata wanita tu mempunyai masalah, contohnya asyik nak muntah bila lepas kemo, hilang rambut, dan banyak mulut, ulcer mulut, dan banyak lagi lah side effects daripada kemo. Dan kita tahu kemoterapi bukanlah satu terapi yang mudah lah. So how to prevent this? To prevent this, from happening is actually to have a cervical screening or pap smear. Okay, next. Okay, cuba tekan sekali lagi. Okay, ni adalah saya zoom in yang tadi tu, statistik 2012-2016. As you can see, cervical cancer is about 6.2 per 100,000 of Malaysian population. So it is not a small number. But surprisingly, after all advocations and also education and also all activities that we do in our society, despite that, the numbers is still increasing in trend. So from 6.2 now in 2018 registrations, the cervical cancer still the third in Malaysia, and the number is increased to 10.8. So that means it seems like we do nothing to help reduce the cervical cancer in our Malaysian population. And previously, from the Malaysia registry, it was Chinese is the highest higher population to have the cervical cancer, but now the statistic has changed. It is the Malay is number one who actually experiencing this problem, cervical cancer. So it is something that we can you can ponder and try to talk to family members about the importance of the cervical screening and pap smear. Next. Okay, from this, what I want to show is actually the age at a diagnosis for women with cervical cancer. So as you can see, the blue line, the highest one there. So this is comparing the vulva cancer, cervix, anus, oropharynx, and also vagina. So of all, the cervix is the highest for the younger women at a 49-year-old. Just imagine, what is 49-year-old? Probably for those who now, probably your age is 20, you think 49 is old, right? It does sound like, oh, it's just old. I don't know if I can reach that age. But think again, if you are now 22, you get married probably next year or this year, and then you start to have babies. And by the time of the age 32, probably or 35, you have your last baby. So if your last baby is 30, at that time you were 35-year-old, then by 49, you will only, your child is only what? 15 or 16-year-old or 14-year-old, form 2. And to lose a mother at such a young age is actually at this point is preventable. So that is why we try to say that cervical cancer is something that we can prevent by doing a screening at early age. That is why we advocate women at the age of 25 until 65-year-old to have their checkup done, routine checkup done. Okay, because we can't lose 49-year-old women. Probably 49 tu you all dah jadi professor ke, dah jadi tak tahu jurusan kat mana kan. We cannot afford to lose you because of cervical cancer, because it is something that can prevent it. Okay, next. Okay, so comparing to the previous topic that was delivered to you about breast cancer, as you can see, breast cancer is something that is number one because it is visible. Women can always complain. There is a swollen, there is a thickness, there is something that they can feel, and then the skin might change and some dimpling, irritations, and also there is some redness. The nipples already inverted, so they come. And then it's so painful. There's a discharge from the nipple. The breast is changed in the size. So there is a lot of complaint in regards to the breast changes whenever they have a breast cancer. But for cervical cancer, it is silent. It's totally asymptomatic. Most of the time, it is asymptomatic. So the cervical cancer is 97% due to the human papilloma virus, HPV virus. So, and 70% of it is because of HPV 16 and 18. 16 and 18. Jadi ni highlight ni sebab nanti ada quiz. And then what is the risk factor for cervical cancer? So first, early sexual exposure. That is why, even though we hate to accept this, but we have to admit that the Malaysian population nowadays, the earliest sexual exposure now is around 15-year-old from 3. If you listen to, I don't know if you go through the newspaper, kan? I mean, online newspaper, you can find some 15-year-old, 16-year-old, probably 18-year-old girl, unmarried, or already pregnant, macam tu. So that is why, because of this early sexual exposure, our Malaysian vaccinations program, we advocate to give HPV vaccine as early as 13-year-old. So the best vaccination is before any sexual exposure lah. Okay. And then if a woman is sexually active, even though in the monogamous relationship, maksudnya memang suami setia, isteri setia, kedua-duanya setia memang, but as you know, a normal healthy sexual life is 2 to 3 times per week. So if a woman is sexually active, they can always get the cervical cancer as well. So I used to have a patient who had been divorced for about 5-6 years. And then after 6 years, then only she comes because of abnormal pervaginal discharge and turned out to be a cancer. So even though the last sexual activity was 5 or 6 years ago, cervical cancer is something that is so latent. The progress of the disease is slow. It might take up about 10 years, then only a woman can diagnose with cancer. So that is why the screening program is long, 25 to 65-year-old. So please don't think that you are in a monogamous relationship, you don't have a risk of having a cervical cancer. It's always associated with 1.4% of women to have a cervical cancer in their lifetime. And the risk is increased if a woman has a multiple partner. Because multiple partner, the partner might carry different papilloma viruses and other viruses that can cause the cervical cancer. And usually the women can also experience concomitant diseases or infection like HIV, gonorrhea, syphilis, and all of this is sexually transmitted disease. That means you get the HPV from a sexual intercourse. So that is why if a woman is never married, never involved in any sexual intercourse, then we don't have to screen them. But if a woman is already sexually active, so do screen routinely. Okay, so again, I want to highlight cervical cancer is a silent killer. Most of the women comes asymptomatic. We can detect during the screening program. And most of the time when the women which achieve menopausal age, for example, for Malaysian population, the menopausal age is about 51-year-old. Usually the women comes at 52 after menopause, they have bleeding. So they thought it's a menstruation. It's not menstruation, it's abnormal. And we have to rule out cervical abnormalities, aka cancer. So we have to rule out that. And also some of the women can have foul smelling discharge, but not all foul smelling discharge can cause cancer. I mean, because HPV always associate with other concomitant disease infection as well. That's why sometimes the women can have foul smelling discharge. Okay, don't freak out if you have foul smelling discharge. It's not necessarily a cancer. It could be just a bacterial vaginosis, but sometimes, okay? So the main point from this slide is it can be asymptomatic in most of the women and only be able to be detected via screening by pap smear and HPV genotype. Okay, next. Okay, this is just highlights on the breast cancer, which you already knew, that 1 in 8 women have can develop breast cancer. And that is number 1. But for cervical, it's about 1.4% of a lifetime risk. Okay, next. Okay, so this is the facts about cervical cancer. So it's the top 3 cancer for Malaysian women, like my previous charts, but it's number 4 in the WHO. The world statistic is number 4. And cervical cancer is something that preventable. How to prevent this? It is by detection while doing pap smear and also HPV genotype. And 3 out of 4 women with cervical cancer is actually young women, less than 64-year-old. And then most of the cervical cancer is due to the human papillomavirus, HPV, specifically 16 and 18. And 6 and 11 usually related to the genital warts. And then cervical cancer occur when normal cells in the cervix change into the cervical cervical cancer cells. So it takes long. It's not 1, 2, 3 years to develop. Usually it takes 10 years, 5 years, 15 years. That is why the screening is until 65-year-old. If, for example, a woman already become a widow at the age of 50, so even though after 15-year-old of the last intercourse, they still can have the risk of developing cervical cancer. So it's a very latent kind of infection. That is why we have to adhere to the screening protocol until 65. Okay, so it can be prevented by regular screening and also vaccination using HPV. It's already been in our Malaysia government vaccination program to have a female student vaccinated at the age of 13-year-old. And also type of cervical screening. Nowadays we have HPV tests. It's a genotyping that can detect type of the HPV. Okay, we'll talk about it later in details. Okay, so next. So basically, every woman is probably a daughter of someone, a wife, a mother, a sister, a lecturer to somebody else. So no woman should die because of cervical cancer because we can prevent it. So I think this poster is the previous poster, the old poster, which at that time, it's the second most common cancer among Malaysian women and 4th highest cancer related to death among the age of 15 to 44-year-old. Okay, so quite young lady have this cervical cancer. Okay, so how do we do about this? Basically, because it is due to the HPV virus and it is sexually transmitted disease, but sometimes, it does not require a penetrative, through vagina. Sometimes oral and also skin to skin genital contact also can be the mode of transmissions of the HPV. So what can we do about this? 1, get yourself vaccinated. 2nd, do a screening. And if there is some early detection, you can do less invasive surgery to prevent it from advance. Okay, next. So what we're trying to highlight here is that it takes about 10 years for the normal cervical cells to develop into cancer. And here where we want to tackle the population, where we want to have a vaccination program done at the age of 13-year-old for Malaysian population and screening to be done at the age of 25 to 65-year-old. So some country will do screening as early as 20-year-old. And if according to RCOG guideline, it is advocated to do at 25-year-old to 65. But everyone agreed to be screening until the age of 65-year-old. Okay. So actually, in 2012, 8 million women were not screened. And out of 7 out of 10 who were not screened actually had a regular doctor and also health insurance. So why are you paying if you're not screened? So do screen and do get vaccinated. Okay. So next, don't miss out the opportunity. So this is WHO. What we want to achieve is that to eliminate the cervical cancer by 2030. We want to avoid of losing 6.2 in 100,000 population because of cervical cancer. We want to avoid this by 2030. How? Do a HPV self-sampling. This is quite limited in Malaysia, but basically women can do the pap smear or HPV sampling at home because some women just afraid to see gynecologists and do the smear. Next. Okay, this picture, I don't know whether the video is working or no, but the picture here, what I want to show is the procedure of doing pap smear. I hope it does not discourage you guys to do pap smear. Basically, it's an office procedure. A woman can come to clinic and it will be done. It does not require any anesthesia to do pap smear because it's supposed to be a painless procedure. So the doctor will insert a speculum, or in Malay we call mulut itik, the one that can be inserted, and we're gonna open up the speculum to visualize the cervix, and from there a cyto brush will be inserted in the vagina, and some cells will be taken from the cervix, and the histopathologist will do a review on the cells. Can you play the video if it's possible? Okay. It takes only about 3 minutes. Tak ada bunyi eh? But it's okay. You can always look at the video in YouTube. Just type pap smear, then you're gonna get this video. Basically, it shows the abnormal cells that is so small, sub-centimeter cells that can replicate and also cause the cervical cancer to be spread to the whole pelvic organ and cause an advanced disease. So this is basically the positions of a woman for pap smear. And then we're going to clean the perineal area and insert the speculum painlessly because the instrument is not that big. Usually if a woman can relax, we can take the sample easily. And this will take about less than 1 minute. And then from there, we get the cells and have a look by a microscope. And we're going to find what type of cell, whether it is normal or not. If it's abnormal, then we're going to grade the cells. This usually takes about 3 weeks to have the results of the pap smear. So it takes about 1 to 3 weeks to evaluate the cells. Okay. So basically that's about pap smear. It is not painful. It's very quick, does not requiring any painkiller to do this procedure. And if the age of a woman is less than 49-year-old, so from 25 to 49, if you have a normal pap smear, then a woman need to repeat every 3 years. If the age until 65, a woman need to repeat the pap smear every 5 years. Do remember this and talk to your family members. Okay, so it's not an annual thing, it's 3 yearly. So if you do it in 2020, repeat again in 2023. Until the age reach 50, then you can have 5 yearly screening. It worth the time and also money because it can prevent such cancer. It can prevent a cancer. Why not do a screening? Okay, next. Okay, I think this is a second last slide. This is to show a HPV test. So HPV test is a human papilloma virus genotype. That means from the cells that we obtain from this pap smear we send for another test to check the presence of the HPV virus. So we are in the era of virus, everything also virus. So yeah. So what we gonna see? Usually the report will be in the such results: high risk, probable high risk, and lower risk. As you can see here, there are many HPV types. The highest risk is the 16 and 18. But in Asian population, usually it's always associated with other type, which is the 51, 52. So there is varies of the high risk HPV virus lah. Okay, so from the report, it's gonna say, okay, for example, negative for HPV, or they will report positive for HPV 16, HPV 18 positive, dia macam tu. So they report dia ikut nama HPV lah. So apart from COVID-19, we have HPV, so many HPV. Okay, and then a lower risk HPV is type 6 and 11, which always contribute to genital warts. So what happened if you have HPV negative? You can go to routine recall, yang kotak kali hijau ni. Routine recall every 3 yearly for those age 25 to 49, but 5 yearly for those 50 to 65. Okay, itu kalau negatif. Kalau positif, so kita akan buat cytology triage. Maksudnya buat pap smear untuk tengok. Ataupun dah ambil sekali and then boleh run je. If you do it in SASMAC at IUM, ni promote hospital sikit. Kalau buat kat SASMAC, we will do both all together, co-testing. Dua-dua kita buat terus. Buat cytology, buat terus HPV. Outside it costs about 150 per test. If it's abnormal, kalau cytology tu abnormal, then barulah kena buat colposcopy. Colposcopy ni adalah ambil biopsi dekat cervix lah. If the cytology normal, then repeat balik HPV setelah 1 tahun, 12 bulan. Macam tu. So I want to show you the pathway so that you won't freak out and you know what to do if you have some abnormalities from the test. Okay, so like I said earlier, this disease is actually preventable by early screening and early detection, and also vaccination. So Gardasil 9 is actually a HPV vaccine for 9 valent. If you look here, if you can zoom in here, there's a 9 type of high risk HPV types that can be prevented with vaccination. However, this HPV-9 is difficult to get in Malaysia. It's not easily available. But in Malaysia, we have another Gardasil, which is bawah sikit lah. Ni teknologi Tesla. So kita tak ada Tesla, kita ada apa kat Malaysia ni? BM. Next, tekan lagi sekali. So we have in Malaysia easily available in primary care setting lah usually, especially dekat private clinic. They have Gardasil 4. So it 6, 11, 16 and 18 recombinant. So you have this 4 most common. But the problem is Asian biasanya saya jumpa kat klinik 45, 51, 52, something that is not appears in our Gardasil vaccination. And in Malaysia, we also imported another one vaccine, tekan lagi sekali, from China. This vaccine, Cervarix, only contain 2 types of the high risk HPV virus, which is 16 and 18. So yang ni ada 2, yang tu ada 4, yang paling bagus sekarang ni 9 lah. Macam tu. Anyhow, vaccination can protect from 16, 18, which is good enough to prevent, because from 97% of the cervical CA is because of HPV, 70% is from 16 and 18. So it's actually good enough. Okay, so for example, you were not in the national program of vaccinations at the age of 13, or you missed the injection vaccination. It is also a rule, even though a woman already exposed to sexual exposure later years. Women can still have vaccination still can have some benefits to protect from HPV, even though dah pernah. Maksudnya, the best vaccination is before sexual intercourse, umur 13. Tapi katakan kalau lah dulu tak dapat and then dah kahwin umur 25, dah 3 tahun kahwin, so baru nak ambil vaksin, itu pun bagus dah actually. Especially kalau buat pap smear and then negative. So, but still ada role untuk ambil vaksin lah, macam tu. Okay, next. I think that's all. Oh, okay. This is tak ada suara juga. It's supposed to be a very touching and emotional video which encourage women today to do cervical screening. So as you can see, in 2018 alone, 311,000 of death because of cervical cancer. It is something that we can prevent because all of you, 90% if vaccinated can protect yourself from getting cervical CA. 70% if you do a screening, 90% if you receive a treatment. With this alone, we can save about 5 million lives. Bosan lah pula suara saya baca ni. Dia sebab tak ada bunyi macam menarik macam tu. Everyone is a mother, a partner, a friend. So let's get ourselves checked and vaccinated from WHO. Okay, I think that's okay. So this is us doing an operation for cervical cancer. So it involves, if you can prevent with 150 ringgit for screening and also vaccinations about 200-300, why not? Because when contracted with cervical CA, then you have to pay all of this surgeon to do the operation. Why pay more while you can prevent it? Okay, I think that's all from me, inshallah.
Thank you, Dr. Yakin, for the great sharing. Brothers and sisters, we have come to Q&A session. To continue Q&A session from Google that is provided, I now invite Sister Fatini to continue the session. Sister Hanis, can you turn on your mic?
Sarah, can you stop presenting?
Okay, sementara transition ni kena macam ada lagu-lagu sikit.
Okay, this is the questions from Google Form. So the first question is, it is normal for someone to have daily vaginal discharge, which is usually yellowish in color.
Okay, first of all, it is quite common to have vaginal discharge, especially sebab macam ni, because vagina, as I've mentioned earlier, it has the capability of cleaning itself. So sometimes discharge ni might be very apa tu, especially bila berbeza-beza keadaan. For example, vaginal discharge akan jadi sangat peak ketika mana seorang wanita tu mempunyai ovulasi. Maksudnya waktu tengah subuh tu, dia punya vaginal discharge akan jadi lebih tebal lah. Lebih macam likat. If women try to get, we always mention to our patient, kalau contoh nak tahu macam mana seorang wanita tu subuh, vaginal discharge tu dia jadi macam sticky yang macam sticky lah macam nak cerita macam tu lah. So maksudnya vagina ni memang secara normalnya dia akan ada discharge lah. Cuma dia tidak sepatutnya terlalu banyak dan dia berubah-ubah mengikut keadaan. Kalau waktu subuh dia lebih tebal, waktu habis period dia akan ada sikit. Tapi dia tidaklah sepatutnya berbau, terutama kalau macam fishy odor, dan dia sepatutnya tidaklah mempunyai warna hijau-hijau sangat macam tu. Okay, so it's quite common. Sometimes it can be normal, but if you experience itchiness and then the foul smelly and then different color, do come and visit us so that we can get a closer look at it. It can be a pathology as well. I hope that's answered. So
Okay.
nombor 2.
Kerap berlaku kegatalan pada kawasan antara labia beberapa hari sebelum period. Tak ada keputihan melampau. Kenapa dan apa solusinya, doktor?
Benda ni agak kerap biasa dengar jugalah ya, sebabnya labia ataupun vulva ni dia akan ada berubah dia punya moisture mengikut kitaran head lah. Jadi sometimes kalau contohnya dia associate juga kalau contoh lepas shave ke apa ke, sometimes dia ada irritation, skin irritation kat situ. So sebab tu akan jadi gatal ke apa ke. So kalau tak ada keputihan, sebab biasa kalau gatal-gatal yang disebabkan oleh candida ni dia akan ada keputihan lah. Tapi kalau tak ada keputihan pun tapi dia gatal, kena check jugalah maksudnya. Have a look and check. All women should have should feel confident and macam ni rasa selesa untuk melihat keadaan vulva tersendiri. Maksudnya what you can do kalau macam gatal, selain daripada menyangka dia adalah benda yang normal, mungkin ada baiknya you tengok sendiri, menggunakan cermin lah, tengok ada tak mungkin ada luka ke lepas shave ataupun mungkin kawasan tu agak kering. Sebab nak jawab soalan ni dia sebenarnya bergantung kepada usia wanita, keadaan dia sama ada menopause ke ataupun pregnant ke ataupun tak pregnant ke. So dia agak berbeza-beza, dia banyak faktor. Probably if you have persistent itchiness without any whitish discharge, curdy discharge that suggest candidiasis, probably you should come and visit us so that we can get a better look. Probably ada masalah lain, contohnya masalah kencing manis macam tu. Ataupun memang ada infection yang menyebabkan kegatalan, contohnya tinea. Jadinya lebih baik jumpa dengan doktor lah kalau persistent. Okay.
Number 3, importance of douching and its effect.
So I think I highlighted this in my talk about the douching. It is not important. It is important not to do it because it can disturb the normal vaginal flora, and the effect is not good. Sometimes it can be detrimental, especially if there is some ascending infection. Nanti jadi pelvic inflammatory disease pula macam tu. So kita nak elakkan daripada infection naik ke atas. Naik ke atas tu maksudnya masuk ke dalam rahim dan ke dalam peritoneum lah. So don't do it. You don't have. It can clean itself. It is so sophisticated that Allah created it that you don't have to clean it. Okay.
Okay, and how to prevent ingrowth pubic hair?
I think the ingrown pubic hair, basically sometimes this can happen, especially macam after shaving or plucking. Sometimes the new follicle can stuck there and cause some bumpy, macam nampak macam folliculitis kat areas tu, and then cause discomfort. What you can do is to leave it. Usually it's you can just leave it kalau tak ada infection kat situ, just leave and wait until the hair tu nak keluar sendiri, then pluck lah macam tu. Guna tweezer untuk pluck. That's will be safest. Kalau waktu tengah sakit ke apa, jangan usik lagi lah. Maksudnya leave it there dulu. It's usually self-limiting. Lama-lama biasanya dia okay lah. But if you have macam persistent problem, do come. Probably a better look can be done by your gynecologist.
Okay, soalan nombor 5. Doktor, apa punca kanser cervix ni? Berpunca dari pemakanan atau genetik?
Kanser cervix seperti yang kita katakan tadi, 97% adalah disebabkan oleh human papilloma virus ataupun infection yang boleh didapati ketika hubungan seksual. Jadi dia bukan disebabkan oleh pemakanan dan dia bukan juga disebabkan oleh genetik. Seperti mana contohnya, kalau contohnya ovarian cancer. Ovarian cancer biasanya associate with breast cancer genetik lah. Maksudnya dia ada genetic inheritance punya pattern. Maksudnya kalau macam ibu dia pernah ada breast cancer ataupun ovarian cancer, anak dia akan ada kemungkinan lah untuk mendapat cancer ovary, tetapi tidak cervix. Cervix lebih kepada HPV.
Nombor 6, boleh tak basuh vagina dengan sumber air? Kalau tak boleh, sepatutnya kena basuh guna sabun biasa ke?
Ni spesifik nanti sumber air saman saya macam mana. Sumber air ni brand apa saya tak pasti, tapi boleh tak basuh vagina. Like I've mentioned earlier, there is so many products out there. There are so many feminine wash lah plus semua. Basically, if it's involved the vagina, kalau cuci luar je tak apa, but cuci dalam tak perlulah sebenarnya, sebab dia boleh bersih sendiri. Dan dia ada bakteria yang menjaga, dan bakteria tu penting untuk kesihatan flora vagina lah. So dengan erti kata lain, tak perlu basuh apa-apa dalam vagina, tak perlu masukkan apa-apa dalam vagina walaupun setelah melakukan hubungan seksual. Boleh tak basuh guna sabun biasa? Ya, selalunya kita basuh guna sabun biasa saja kawasan vulva. Sebaiknya tak payah sabun sungguh-sungguh sangatlah dekat kawasan, sebabnya kita tak nak dia mengganggu flora normal.
Okay. Nombor 7, how to clean it especially when we are in ovulation mode?
Dia biasa kalau macam progesterone tengah high kan, macam pregnant lady ataupun tengah ovulation, memang discharge tu akan jadi lebih banyak lah berbanding biasa. So how you can do it is, satu, if you think it's too thick, discharge tu banyak dan mengganggu kehidupan, probably using a panty liner is a good solution. And keep changing the panty liner, especially at work kan, macam susah nak tukar panties, so tukar panty liner lah. And then make sure you use a cotton undergarment so that it can give a better ventilation and less irritation to the private area. How to clean it? Just make it dry and clean. Keep changing panty liner. I'm talking about a normal condition lah. Kalau yang macam saya kata tadi, kalau foul smelly apa semua tu do come, probably you have to be treated with antibiotics. Not really because of the hygiene.
Okay. Nombor 8. It is normal for someone to have daily vagina discharge which is usually yellowish in color.
It can be normal. It's quite common. But if you have some macam rasa macam risau normal ke tak normal ke, you can always get yourself checked, because probably at this point, rather than sebab banyak soalan yellowish vagina discharge, 3 soalan. It seems like probably it's a very macam mengganggu kehidupan seharian kan. If you really worried about it, probably it is good to come and visit us in Sasmek IUM. We can do and help and investigate rather than thinking it's just a normal thing. Macam tu. But it is quite common and it is can be normal condition to have vaginal discharge.
And number 9, it is normal if the vagina have a smell. How to reduce the smell?
If it's a smelly discharge, probably at this point it's shown some infection ongoing. So how to reduce? Take antibiotics depending on the recommendation. Apart from maintaining the perineal hygiene.
Okay, number 10, kalau nak basuh tangan tu depan ke belakang? Kalau ke depan, apa akibatnya terhadap vagina?
Ni saya nak lukis. As you can see kat depan ni, kat depan kat depan ni ada urethra opening. Tempat buang air kecil kat depan kan. Tengah-tengah tu vagina. Belakang adalah tempat buang air besar lah, tempat berak. Okay, so tempat buang air kecil ni biasanya adalah dia sepatutnya sterile. Maksudnya tak ada bakteria yang masuk ke kawasan saluran air kencing lah. Maksudnya it should be sterile. So apabila kita basuh buang air besar, sebenarnya kita lebih baik basuh dari depan ke belakang supaya bakteria dari sebab kat depan ni bersih, bakteria tak ada, so kita basuh ke belakang. Kalau kita basuh dari belakang ke depan, bakteria daripada belakang ni boleh datang ke depan. Bakteria daripada anus boleh pergi ke urethra, menyebabkan infection lah. So sebab tu nak prevent, kita basuh dari depan ke belakang. Macam tu lah. So it's a good hygiene practice to wash from front to the back.
Okay, nombor 11, kalau ada jerawat di kemaluan, apakah cara terbaik untuk hilangkan?
Soalan ni susah nak jawab sebab jerawat ni kena tengok balik. Adakah dia sebenarnya genital lesion? Maksudnya dia adalah genital lesion, maksudnya dia adalah ketumbuhan yang disebabkan oleh infection, ataupun dia sebenarnya adalah follicles yang tersumbat, bulu ari-ari yang tersumbat dan infected, ataupun apa. So kalau ada jerawat ni, kita kena tengok balik apa sebenarnya jerawat tu apa. Sebab jerawat tu is a common term yang tak spesifik. Because if you have genital lesion, then treatment dia lain. If you have a folliculitis, jawapan dia lain. If you have a herpes infection, jawapan dia lain. So jerawat ni, if you think it is disturbing, it's painful, come and visit your doctor. InsyaAllah there is a treatment for those condition. So kalau ada jerawat ni, apa cara terbaik? Kena tahu apa sebenarnya jerawat ni, apa dia, dan bergantung kepada penyebabnya, kita boleh rawat melalui situlah. Okay. Janganlah malu berjumpa dengan gynecologist.
Okay, the last questions. Is cervical cancer considered as an STD?
As mentioned earlier, it is one of the sexual transmitted disease, but not necessarily via penetration. Oral sexual also can, skin to skin pun boleh juga. Dia bukanlah pegang orang terdapat, taklah maksudnya. The transmission tu can be varied, but it's a sexual transmitted disease. And if one never had any sexual intercourse, it's very unlikely to have a cervical cancer lah. Tapi itulah kalau contohnya dah bercerai 5 tahun, dia still ada possibility untuk dapat cervical cancer walaupun dah 5 tahun tak ada sexual intercourse. Walaupun dah 10 tahun tak ada sexual intercourse, still boleh dapat cervical cancer. especially kepada wanita yang berumur 65 tahun ke bawah. So it is one of STD lah. Okay, I hope it clear your mind.
Yes. So we will proceed to questions from YouTube.
Question from YouTube. How do I look at the question? Oh, okay. Oh, Dr. Fatima Muhammad Noor asking which one is more effective, fast twitch or slow twitch for SUI. So for SUI is stress urinary incontinence. It is a condition where a woman experience a urinary leakage whenever there is some increase in the abdominal pressure. For example, while coughing, sneezing, or laughing. So it's quite common. So which one is more effective? To have a good effects, you have to do both fast and slow twitch, because the fast twitch is actually tackling the white fiber, and then the slow twitch is tackling the red fiber. So you have to have both muscles involvement to have a good hold of the urine. So it is good to do alternate. Maksudnya buat fast and then slow, buat fast and then slow. Tapi kena complete dia punya cycle lah. Maksudnya 10 cycle macam tu. So which one is more effective? We need both to have an effective Kegel exercise for SUI. Thank you for that question. Dr. Fatima Muhammad is my sister, is a plastic surgeon. Thank you for attending. Aizatul Kurama, Assalamualaikum. I have a question about reverse vagina. Are the percentage to have children is as high as people speculate? I think what Puan Aizatul said is actually reverse vagina, or probably it's a retroverted uterus. Because the vagina axis usually the same. I mean the vagina biasanya semua sama lah. It's a hollow organ. Yang selalunya reverse ataupun antivert ni adalah dia punya uterus. Yang saya kata tadi agak common kepada wanita yang mempunyai endometriosis. Sebenarnya potensi untuk ada anak tu sama je, antiverted ke retroverted. Cuma dalam retroverted uterus ataupun rahim, sepatutnya rahim ke arah ke depan ke bladder, tapi retroverted ni dia ke belakang macam tu. So untuk wanita macam ni sebenarnya potensi untuk dapat anak tu sama, tetapi kebanyakan wanita yang mempunyai retroverted uterus selalunya mempunyai masalah sampingan yang lain. Contohnya endometriosis. Jadinya dia menyebabkan bukan retroverted tu sahaja yang mengganggu. Retroverted tidak mengganggu kalau tak ada masalah lain. So sometimes wanita yang retroverted ni tube ada masalah ke, ada masalah endometriosis ke adenomyosis ke, jadinya ada benda lain yang mengganggu lah kesuburan tu, bukan disebabkan oleh retroverted sahaja. Retroverted boleh mengandung sebenarnya, insyaAllah. Tetapi sekiranya puan risau, boleh jumpa dengan doktor lah. Mungkin ada benda yang kita tak perasan kan, kalau tak investigate tak tahu, tak perasan yang sebenarnya ada masalah lain juga. Okay. With food intake, Izzah Noor, does cervical cancer has associations with food intake? Basically, cervical cancer is a sexual transmitted disease. It transmits via sexual intercourse, and 97%, most of the case is because of human papilloma virus infection. So eat whatever, but eat healthily. From eating, you won't get cervical cancer, but you get obesity, you get diabetes, you get other associate comorbidities lah. Eat anything. It won't cause cervical cancer, but other disease. So eat healthily. Thank you very much. Izzah Noor is also my sister. She's working as a banker in Maybank. Putri Adib, comparing to before and after HPV vaccine was implemented, does HPV vaccine shows any significant effect in preventing the cancer? So I think this Putri Adib is asking because of the statistic that shows increasing in trend of the cervical cancer. But bear in mind that the cervical HPV vaccination is just recently applies in our government policy. So orang yang dapat vaksin umur 13 hari tu tak umur 49 lagi. So kita tak nampak lagi by statistik. Tapi maksudnya by numbers tu mungkin tak nampak lagi. Mungkin we have to wait for another 20 years to see the outcome of the vaccination. Because mungkin orang yang dapat vaccination hari tu sekarang ni umur dia baru 35. Tak sampai lagi umur peak of the cervical CA tu. But sepatutnya by calculation or projection sepatutnya dia boleh improve lah. It has a very good protective 90% if you get vaccinated, insyaAllah 90% protection from cervical cancer. Another 10% contributed by the HPV yang tak ada dalam vaksin. Yang 51, 53, yang tu. Okay. Siti Nur Syakira Zulkifli, kalau shoot vaksin akan kena juga about 10% still there is a risk of getting cervical CA. That is why regardless of your vaccination status, you still need to be screened every 3 yearly for those less than 50-year-old, and for those less than 65-year-old, 50 to 65, still you need to be screened every 5 years regardless of your vaccination status, because we don't know. We have tackled the 16 and 18 type, but we have other type of high-risk HPV that is not present in the vaccination. So yeah, do screen even though you have vaccinated. No name. Ada frequent discharge, green, yellow discharge, dah ambil ubat antibiotik, and that kind of discharge dah berkurangan, but after few weeks discharge tu ada balik. What should I do? Because saya dah ambil ubat tu 3-4 kali, I see. So in case of the persistent infection, sometimes there is a depends on type of the infection. There is some prophylactic prophylactic antibiotic that can be offered to you if you have this persistent infection. So there is a different antibiotic regime to tackle this issue. So the best is don't take antibiotic over the counter. Do find a doctor. And one of the things that I think the issues with us is that sometimes malu kalau ada discharge. So sometimes pergi GP satu. Lepas tu GP satu ni jadi balik. So tak naklah pergi GP yang sama, pergi GP yang kedua pula. Lepas tu dah pergi GP kedua dapat antibiotik hilang, lepas tu pergi GP yang ketiga. So doktor tak dapat nak follow up you punya case sebab keep jumping different facilities. So if you have this kind of trouble, probably it is good if you can follow up at one center so that a better evaluation and offer can be given daripada jumping around. Because everyone, when we see a new case, we will start slow. Maksudnya kita tak start terus antibiotik yang tinggi. Kita akan slow, try satu-satu lah. So you are wasting the time if you keep changing medical facilities. So jumpalah dengan satu doktor, and macam orang kata dah pilih satu tu, try lah dulu dengan satu doktor tu. Selalunya masalah yang macam ni dia tak mudah untuk diselesaikan lah. It takes time. I hope you can find a doctor and you can do a proper follow-up for your condition, insyaAllah.
Okay, this will be the last question.
Last question. So Aizatul Kurama is asking how to balance the pH in the vagina. Any food intake can improve the pH. I heard before taking Yakult or Vitagen is improve the pH. Sound legit. So basically, the healthy vagina flora is the lactobacilli, and yes, they can cultivate the lactobacilli, and there is products in pharmacies which offer the lactobacilli for those who's having persistent vagina infection kan, ataupun candidiasis. There is a sachet in drink, there's a tablet to apply it inside the vagina to improve the pH, to restore the normal flora in the vagina. So yes, there is such thing. But Yakult and Vitagen, I have to probably it is best for Puan Aizatul Kurama to have a look whether they contain lactobacilli or no. This is not a promotions video. So kena check balik lah Yakult dengan Vitagen tu.
Sorry, doctor. One more question, boleh?
Apa dia?
Tak kisah beza apa pun. Tak kisah. Nuri.
Can you give me like 1 minute? There's some announcement in my hospital.
Okay.
Okay, so Puan Zakia is asking, all blood, a few days after period, 7 days period, there's a drainage like brown and whitish tissue, young continues by years. Is it normal? I found it. This question is, I need to know more information to give I need more information to deal with this kind of problem because normally menses is lasted until 15 days. 15 days. If you have a prolonged menses more than 15 days, and depending on your age and then your risk factor, it is better to see your doctor because sometimes it is not normal. We cannot assume that this prolonged menses or prolonged menstruations is just because of stress or hormonal imbalance. It might be due to other things because menses is not only the issue with the uterus. Sometimes it's the issue with the ovary. Sometimes it's the issue with the cervix. So sometimes it's issue with the uterus where women can have fibroid, polyps, a lot of things that can cause this kind of trouble. So really we have to have more information and also further evaluation before thinking it's just because of the stress. So to Puan Zakia, if you have menses more than 15 days, we call it a prolonged menses. If it's heavy, then it is not normal. You have to have a thorough look at your at the organ. Do visit your gynecologist.
Okay, that's all for the question and answer session. Thank you for answering all the questions, Doctor. I'm sure that all of us are excited to look forward with what Dr. Yakin just shared with us today. Friendly reminder to always take care of our genital hygiene and remember, prevention is better than cure. Alhamdulillah, we have come towards the end of our program. Brothers and sisters, it is time for a quiz session. The link for the quiz is attached in the chat box. If you have gave full attention during presentations, you might stand a chance to grab special prize prepared by the organizing committees. Quick announcement to fellow audience. Don't forget to fill in the attendance and evaluation form given after you finish answering the quiz. Before we end our event tonight, on behalf of the organizing committees, we would like to express our utmost gratitude to our Honorable Dr. Nurul Yakin Muhammad Noor and all individuals that involved in this program. Thank you very much for your participation in this event. We also apologize for any shortcomings during the program. By the grace of Allah, let us end this event with the recitation of Surah Al-Ars and Tasbih Kafarah. Bismillah. Thank you so much for joining us, and thank you to Dr. Yakin, and wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Thank you and stay safe.
Before we end this session, I will come all of you to turn on the camera photography session that will be led by Sister Amira. I will like to call. I welcome all of you to turn on the camera for the photography session that will be handled by Sister Amira. That will be led by Sister Amira as well. Before tutup semua tu, Ellie kena make sure Kak Mia tu ada. Maaf kalau tak ada. Cik nasi dah habis. Ada sasa benar.
وتوب علينا توبة نصوحا أستغفر الله رب البرايا أستغفر الله من الخطايا أستغفر الله رب البرايا أستغفر الله من الخطايا أستغفر الله رب البرايا أستغفر محمد صلى الله لا إله إلا الله محمد رسول الله حسبي ربي جل ما في قلبي غير الله محمد صلى الله لا إله إلا الله محمد رسول الله حسبي ربي جل الله ما في قلبي غيره محمد صلى الله لا إله إلا الله محمد رسول الله حسبي ربي جل الله ما في قلبي غير الله محمد صلى الله لا إله إلا الله محمد رسول الله حسبي ربي جل الله ما في قلبي غير الله محمد صلى الله لا إله إلا الله محمد رسول الله لا إله إلا الله محمد رسول الله لا حول ولا قوة إلا بالله 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 حول ولا قوة إلا